All right, we're ready to go into the next part of the talk that Dana provided to us, and that is looking at Part B infusions, how it works, and also prior authorization. I have to first say that the video was a bit glitchy, so I had to re-record, but I am using her words and her script. So the wisdom I am about to share is not mine, it is Dana's. All right, let's look at it. So when we go back into Medicare.gov, again, scroll down, find health and drug plans, find plans now. So again, you're going to put in your zip code. And here we're going to look at, well, let's look under the drug plans, right? So find drug plans. So assuming we have no assistance, I'm going to say I don't get any. Do you want to see drug costs? Yes. All right. Here's where it's going to tell you to put in your drugs, right? So if I put in, like we have before, let's just for kicks put in prednisone. Oops, prednisone, sorry. I don't know why it's being difficult on me. There we go. So it's going to show up, right? Now, what if, we're just going to add that. Let's put in a Plisna. No results. Let's put in Truxima, which I know many people are on because it is a biosimilar for rituximab or Rituxan, not listed. All right, let's put in Rituxan, not listed. All right, do you know why those things aren't listed? They're not listed because they are Part B. So if it doesn't show up here, then that means that it is covered by Part B. And the challenge is there's no easy way to search for Part B drugs. So you can go to Google. I've already done this, and I put in is a Plisma on Medicare formulary. And you're going to look down here and you see it is typically covered under Part B, not Part D. And it's going to tell you it's because it's administered in a healthcare facility and you have to meet these conditions. So here you can see IgG4 is listed. Uh, the diseases that it's going to be covered are going to show. It's also going to give you a lot more information about how all of this works. But here's where you can find out, oh, it is covered. And that would be the same for, let's just try, just for kicks, is Truxima covered under it? Yes, it is covered by Medicare. So this is one way you can make sure that it is part of the Medicare formulary. Now, if a drug is brand new, it may or may not be listed as covered. So when a drug is covered under Medicare Part B, it will have something called a HCPCS code. That is usually the J code. The J code is specifically the way they bill for it. Again, if a drug is brand new, it may not have been assigned a J code yet, but the physicians can still bill it for the infusion under an unspecified code. So once the drug is approved, it can be billed by the FDA. It can be billed by your physician. If you're in the physician's office or an infusion center under original Medicare and under Medicare Advantage, it can be billed using an unspecified J code. So if you're curious about whether or not it has a J code yet, you can put in what is the J code for Truxima. So actually the ones that we're talking about, so like a Plisna, that actually has a J code. Let's see, what other ones let's just do Rituxan. There's the J code for Rituxan. So again, the J code is going to tell you whether or not it has been assigned a specific code. What is the unspecified J code? J code that is unspecified is one that doesn't have a HCPCS number yet. Here are some unspecified codes. Your physician's office, the billing office at the infusion center should know all about that. You shouldn't have to worry about that. Now, another thing to know is if you have traditional Medicare, go to a slide now. If you have traditional Medicare, then it's going to be covered under your Part B, and there's no prior authorization and there's no 20% coinsurance because it would be covered by your Medigap plan or by your plan that is under your Medigap plan supplemental plan. So again, if you have traditional Medicare with Medigap, it is going to be covered under Part B, and you will not have a 20% coinsurance, and you will not have prior authorization because that's covered under your Medigap. If you're on Medi-Medi, which is Medicare and Medicaid, they do offer covered Part B benefits. They have to, by law, cover the same thing that Medicare covers. So that's the case for all Medicare Advantage. So if you're on Medicare Advantage, you will have to pay the 20% coinsurance copay. There's no real way to know the cost. You can look up the cost for the drug, but it's going to show you the list price, and no one ever pays the list price. So it's not very reliable to look that up. Remember, this is where the out-of-pocket maximum comes in. If you have a $4,000 out-of-pocket maximum, then even if your infusion is worth $5,000, you will pay $4,000 and you won't pay anything for the rest of the year. So it's again important to not just look at the deductible, but also to look at the out-of-pocket maximum. With Medicare Advantage, and they will often require prior authorization. And of course, make sure that you have a specific disease, and we will likely fit under that, especially if we're picking one that is FDA approved. If it is not FDA approved for your specific disease, that can get a little trickier, but it can still be covered. So don't give up. All right, so also Medicare Advantage can prohibit that you're not on other drugs. So they can say, all right, you can have this infusion, but you can't also be on XYZ drug. So again, this is really tricky to find this information because Medicare Part B, not Part D, B as in ball, does not have an easy access to look all of that up. There in this slide deck, it's going to be all laid out here. It's also then going to go into prior authorization forms. And you can look through all of these different pieces of prior authorization and read through what your doctor fills out for prior authorization, and also find out ways that you can assist your doctor in getting that prior authorization. Now, if your 20% copay is just too much money for you, you can look into assistance. So a lot of these companies have assistance. Some assistance is not covered by Medicare. So, for example, copay assistance cards, those are not eligible under Medicare. But most of these companies have programs. So I'm just going to show you a few. So here's AstraZeneca's tool. It's a brand new tool they rolled out. You're going to fill out who am I? I'm the patient. What's the medication? I'm going to pick Fasenra. If I can find it. I mean, they do have just a few medications. Here's Fasenra. What kind of insurance? Here's where you're going to be able to choose. I have government insurance. So that is Medicare, Medicaid, Medigap, all of that. So I'm going to choose that. And this is going to then tell me, here are the programs that I can access to find out how I can get financial support. So it'll pull that up specifically, and that is again an AstraZeneca US patient support tool. Uplizna, Amgen also has a similar kind of thing. Amgen by your side, Uplizna. If you put that in Google, it's going to let you look up this information, and you can contact them and they will help you get through, step by step to make sure that you have the coverage that you need. That is what they're here for. And all of these companies are really great. They have people who are dedicated to doing nothing more than helping you get the coverage that you need. Let's look at one more. If you are wanting to go on Ultimaris and that's through Alexion, you can look up Alexion OneSource. They also have this tool, and you can reach out to them at any time and you can ask them for assistance if you're trying to get coverage. So if you hear, oh, it's not covered, or the copay is too high and you have some financial limitations that may or may not be applicable, then reach out to these different these different companies, these different manufacturers, and ask them for their assistance in getting you covered. If you don't know the name of the tool for this, then just put in the manufacturer's name and it will come up. So let me see. Let's put in the manufacturer's name. We'll put in for Rituxan. Rituxan is made by Genentech. Genentech, um, Rituxan, patient assistance. Let's just check this out. Medicare. So here's Genentech Access Solutions. Explore Rituxan. Oops. Okay, I'm a patient. Accept all. I'm a patient. So Genentech Access Solutions, find financial assistance, and I can choose Rituxan. And as you can see, Rituxan is a great example because Rituxan is actually not FDA approved for many of the things that we use it for. So, for example, I have eGPA. Many people with eGPA use Rituxan. It is not approved for that. So that can be a little tricky in getting approval. But here it is approved for GPA and MPA. So let's just go into that. So you can reach out to the Genentech group and you can find that. But that's all I had to do is I just had to put it into the name of the manufacturer, the medication, patient assistance, Medicare, and you can look up and see. Now, real quickly, back to the prior authorization. If you request prior authorization and get denied, please tell your doctor that you'd like a redetermination, and that will help you. Let me see, I probably closed the slide deck, but here's the reconsideration. So tell them, don't just listen to that and hear that it's denied and give up. Absolutely not. Tell your doctor's office, we need to go for a redetermination, a reconsideration. And that's going to take a lot of paperwork. So keep that in mind. If you can assist the doctor by providing them information, that's always helpful. And we have a lot of that on our website. But this is your benefit. And technically, you can fill out these forms. You do often need a doctor's signature, and I have done that. I have filled out all of the form that I am able to fill out, like my basic information. That saves the doctor's office a lot of times. I mean, they have a lot of time. They have hundreds of people that they're serving. I can even fill out their prescriber information. Of course, I can't sign for it. So do your doctor's office a favor, fill out some of these forms wherever able, and then give it to them and ask them to continue to fight for you. This is your benefit. So get in there with your doctor's office.